Hello and welcome to AtheroTalk, the podcast series by the EAS Young Fellows, where we bring you closer to the people shaping cardiovascular science and atherosclerosis research. I'm Pelin Golfrouge and I'm delighted to welcome you to this special episode. As part of our mission to make AtheroTalk truly global, today we're heading to Argentina to speak with a leading expert in lipidology and cardiovascular prevention. Our guest is Professor Pablo Corral, an internal medicine and lipid specialist, coordinator of the Lipids and Atherosclerosis Department at the ICM Institute in Mar del Plata, and professor of pharmacology at FASTA University. He is the past president of the Argentine Lipid Society and an award-winning researcher with a strong focus on familial hypercholesterolemia, residual risk, and genetic dyslipidemias. He has also been actively involved as principal investigator in major international trials, including COVID, Prepare It, LP(a) Horizon, V2P trial, Coral Reef, and Azure programs. Dr. Corral, it's a pleasure to have you with us. Thank you for joining and representing Argentina in this global episode of AtheroTalk.
Thank you very much. My pleasure to be here and to share with you some insight for me and some topic about my life and talking about science, and it's a pleasure.
Let's begin by getting to know the person behind the profession. Could you start by introducing yourself to our listeners? Who is Pablo Corral?
Well, basically, I'm an internal medicine physician and a lipid specialist based in a relatively small city. It's called Mar del Plata in Argentina, where I see patients every day in clinical practice. I'm also a full professor of pharmacology at my local university, and I work as a clinical investigator in phase 3 trials and as well as epidemiological studies. At my core, I'm deeply passionate about science and medicine. For more than 20 years, my main focus has been atherosclerosis, lipid, cardiovascular disease, and also prevention. On a more personal note, I'm a father of 2 lovely daughters, future physicians, and I truly enjoy, for example, nature, traveling, science, and stay physically active.
That's great to hear. It's always nice to see the human side behind such an impressive career. Could you describe what a typical day looks like for you? How do you balance your clinical work, academic responsibilities, and research activities, or maybe any hobbies as well?
Yeah, sure. A typical day starts very early, usually around 5:30 in the morning. The first things I do is exercise. I love exercise, living in a coastal city right by the sea. If the weather allows it, I go for a run on the beach. If not, okay, I train indoors. After that, and a good cup of Colombian coffee, my academic day begins. I spend some time reading and analyzing recently published research and catching up on mails. Uh, then my clinical work starts. I see patients from around 2 a.m. to in the afternoon, which remains the center part of what I do. And in the afternoon, my activities vary. Some days I go to the university where I teach pharmacology. Other days I'm at the researcher center following ongoing clinical trials. But also I dedicate time to writing, reviewing manuscripts, as I serve as an editor and reviewer for several journals. And importantly, spend time, obviously, with my family and friends.
That sounds like a very full schedule, but also incredibly impactful as well. Many of our listeners are early career clinicians and researchers navigating similar paths. What advice would you give them as they begin to balance multiple responsibilities?
Well, I think that the most important advice I can give to young clinicians or researchers is to find something you're truly passionate about, something that gives you a sense of purpose and even enjoy. That makes a big difference, at least for me, because it helps you to avoid feeling overwhelmed by the daily routine. At the same time, it is essential to maintain this balance between academic work, physical activity, good nutrition, proper rest, and meaningful social interactions. I believe that the balance it allows you to feel more comfortable with what you do and prevents your work from becoming, yes, a burden. It also helps to navigate to the more difficult moments, which are inevitable, and to truly appreciate your achievement. But I think that the most importantly, I think we should focus on enjoying the process. The goal is important. I have to say that it's important, but it should be a consequence of the journey, not the only reason for it.
That's really valuable advice. And it's true, so important to have your passion for the work that you do, especially for those just starting out. Let's take a step back and talk about how your journey began. What initially drew you to internal medicine and later to lipidology and atherosclerosis research?
Well, I think that I always knew that I want to become a physician. I was never really a question. I never seriously considered anything else, even from a very young age. For early on, I was drawn to internal medicine because it offers, at least for me, a broad and a comprehensive view of the disease, while at the same time also allowing you to do later focus on more specific areas. That's why I completed my residency in internal medicine, and even today I still consider myself as internist at my core. But over time, I developed a particular interest in lipid and atherosclerosis, especially in understanding the mechanisms behind the disease development. And more importantly, how we can prevent it. Then pharmacology played a key role in that journey. I become a bridge between my curiosity about the physiopathology and of the atherosclerosis and the therapeutic strategies we use to modify it. In a way, this combination between clinical medicine, physiopathology, and pharmacology is what utterly shaped my career.
It's always interesting to hear how those early decisions shape a career. Were there any mentors or role models who played a key role in guiding you along the way?
Yes, I think that I have to mention two people who have truly shaped my path of as a physician and as a scientist. First, my father. My father was also a physician, an internist, and infectious disease specialist, and yes, he probably played the most important role in transmitting to me the deep passion for medicine, science, and patient care. And a second, more closely related to lipidology and atherosclerosis, Professor Laura Sebray from the University of Buenos Aires. She has been a key mentor through my career in this field. And over the time, that relationship has evolved not only into mentorship, but also into a strong collaboration and friendship, which I truly value.
That's so nice to hear. Mentorship truly makes a difference in this field. Before we move on, is there a current project or initiative, perhaps one of the trials you're involved in, that you're particularly excited about right now?
Yes, I'm currently involved in several projects, which probably reflects part of my personality. I tend to be curious, restless, and continuously engaged in multiple initiatives at the same time. Among them, I have to say, I would say that development of species kinase inhibitors, particularly that oral therapies, is one of the most exciting and potential transformative area in lipidology and cardiovascular prevention today. In parallel, I'm also involved in LPA registry projects in Argentina and across Latin America, which I believe will be critical for better understanding this cardiovascular risk in our region. At the same time, participating in international forums focusing on complex and less common lipid disorder remains an important part of my work. I think that, yes, altogether, this initiative reflects both the scientific challenge we face today and the opportunity to bring more precise and effective strategies in clinical practice.
That sounds like a very exciting and impactful line of work. Focusing specifically on education and popularization, could you tell us more about the LP little a, Gale LP little a? What does it offer to researchers, clinicians, and the wider public?
Yes, absolutely. GAELPA project has a major challenge. It's a very, yes, rewarding one. After nearly 3 years and a half since its inception, it has allowed us not only to generate value data from Argentina, but also to begin expanding this initiative to other countries across Latin America. This work has led to multiple presentations at both national and international scientific meetings, as well as publications included in journals such as Atherosclerosis. But beyond that, it's believed that the real value lies in generating local and regional data, because understanding how LPDLA behaves in our population is basically essential if we want to improve patient care. So ultimately, this knowledge will help us to better understanding the condition and hopefully improve the prognosis of patients with elevated levels of Lp(a).
Speaking of promoting research, guidelines, and novel clinical treatments, what channels do you use most often? Which one has the widest reach? And which channels does the Argentine Lipid Society use?
Yes, I think that the most solid and really big channels remain scientific meetings with presentations and publication in peer review index journals. That is still the foundation of how we validate and disseminate knowledge. Uh, that said, the globalization, especially social media platforms like LinkedIn or including X, has changed the landscape. They allow for almost immediate interaction with colleagues all around the world, and we can be very useful for sharing new data and perspective. Of course, the key is to use this platform with responsibility, ensuring that what we communicate remains scientifically sound. Uh, Regarding Argentine Lipid Society, as a former president, we relied on several channels: our official journal, our annual in-person meeting held every September, and our presence in social media. So together, this platform allow us to reach more of the scientific community and a broader audience.
Yeah. And you've already briefly mentioned this, but what do you think about the importance of social media for knowledge dissemination?
When it comes to social media and the knowledge dissemination, I believe it can be very useful too. Uh, but again, if it's properly used and with responsibility and scientific integrity. The problem is that not everyone use it in the same intentions. So in some cases, the measures can become distorted or oversimplified, and which is a real, I think, is a real risk. So again, it comes down to how we use it. For example, it's the approach is seriously, and social media can be an important role in spreading new knowledge and engaging with broader audience. But it should never replace scientific rigor. It should complement it.
Yeah, I guess every platform has its pros and cons. You've been involved in several major international trials, including LP(a) Horizon, V2P trial, Coral Reef program, and Azure program. From your perspective, how are these studies shaping the future of lipid management and cardiovascular prevention?
Yes, you're right. I believe that we are living through a truly unique moment in cardiovascular prevention, particularly in atherosclerosis and lipids. The trials we are seeing today have the potential to make a turning point in how we manage our patients, both in primary and secondary prevention. For the first time in many years, we are not only refining what we already do, but fundamentally expanding our therapeutic possibilities. So, yes, I think that we need to pay very close attention and also take a moment to appreciate this space, because what we're studying now is we really shape the clinical practice for years to come.
Yeah, that's a fascinating perspective, especially as these trials continue to influence clinical practice. You've also worked extensively on familial hypercholesterolemia and genetic dyslipidemias. What progress have you seen in recent years in terms of diagnosis, screening, and awareness, particularly in Argentina and across Latin America?
Yes, we can work a lot with FH and genetic in the past, yes, 10 or 15 years. I'm a true believer that genetic has made a significant advance in recent years, not only in FH, but also in our understanding of less common dyslipidemia. For example, in Argentina, in collaboration with international groups, we have been able to better characterize patients with FH and perform genetic analysis. Well, we found some variants that we never knew about FH and will explain some phenotypes. This allowed us to identify the most frequent pathogenic variants in our region and to better understand the genetic profile of these patients. Ultimately, this contributes not only to improve local diagnosis and management, but also expanding global knowledge about this field, particularly with the genetic analysis.
It's really encouraging to hear about that progress. What do you see as the main barriers and perhaps opportunities for improving FH detection and treatment in the region?
Yes, well, I believe that we have a major opportunity today to improve the debate on patients with FH. For example, advancing laboratory data integration with artificial intelligence, big data are opening new possibilities to identify this patient more efficiently. But technology alone is not enough. This requires coordinated efforts across multiple stakeholders like scientific societies, healthcare providers, patient associations, physicians, and even laboratory specialists. If we align these actors, we have the real opportunity to significantly improve detection rates. And that matters because, as you know, the benefit of early diagnosis and treatment of this patient has been clearly and consistently demonstrated. So I have to say that we need to work all together in order to improve detection and better treatment and early treatment for this group of patients.
That's a very important point, especially from a public health perspective. Another key concept in your work is residual cardiovascular risk. How should clinicians think about this today, particularly in patients already receiving standard therapies?
Yes. When we talk about the residual cardiovascular risk, I think the first and the most important point, and it for me, often is overlooked because the main residual risk is simply not achieving the LDL cholesterol target. That remains the primary driver. Decades of scientific evidence have consistently shown that lowering LDL cholesterol is the cornerstone to preventing atherosclerotic cardiovascular disease. Of course, there are other contributors to lipid-related residual risk, such as Lp(a) and cholesterol-rich red mass. And beyond lipids, we have also well-known factors like smoking, obesity, hypertension, diabetes, inflammation also. But in my view, this should be addressed on top of a solid lipid strategy, not instead of it. If we don't get LDL right first, we are building on unstable ground. I think so.
Yeah, that's a crucial reminder that treatment doesn't stop at guideline targets. How do you see the integration of pharmacological treatments, lifestyle interventions, and emerging therapies evolving in cardiometabolic care?
Well, this integration of three components is essential, and they are not mutually exclusive. On the contrary, early lifestyle intervention, current pharmacology treatments, and emerging therapies should work together as complementary strategies. The goal is to modify the natural course of atherosclerosis cardiovascular disease, but this can only be achieved with thinking additive, not competing approaches. Ultimately, it's about yes, combining all available tools to improve long-term cardiovascular outcomes for our patients.
It really highlights how multifaceted cardiovascular prevention has actually become. Looking ahead, what do you see as the next major priorities for advancing lipidology and atherosclerosis research in Argentina and across Latin America?
Well, I believe that one of the key priority in lipidology and atherosclerosis, both in Argentina and in across Latin America, is the generation of local data. Yeah, I think it is essential to that we conduct real world research within our own population rather than rely exclusively on data from other regions. This means strengthening collaborative efforts among researchers, clinicians, and scientists across Latin America. By doing so, we can better understand the regional local characteristic of lipid disorders and atherosclerosis. And ultimately, this will allow to develop a more accurate and effective strategy tailored to our patients.
It's exciting to think about how the field will evolve through collaboration in the coming years. With your involvement in international trials, how do you see emerging therapies such as novel lipid lowering agents changing clinical practice in the near future?
Uh, well, there is no doubt that emerging therapies will mark a turning point, as I said before, in the daily clinical management of patients with dyslipidemia and atherosclerosis, cardiovascular disease. Uh, for example, achieving target that we previously considered it unattainable and demonstrated safely at the very low yet physiological levels of LDL cholesterol will translate in meaningful benefits, both in the prevention of first event and also in reducing recurrent events. Once again, I think we are living through a particular exciting era defined by new mechanisms, new molecules, and new pharmacological strategies. And ultimately, all of this will translate in better clinical outcomes for our patients.
That's really exciting and a very promising outlook for both clinicians and patients. Before we close, we like to include a short reflective segment we call the graveyard of ideas. As researchers, we often celebrate successes, but setbacks can be just as important. Could you share an example of a project or idea that didn't go as planned but taught you something valuable?
Oh, well, I think that we often learn much more from failures than from success. In my experience, for every, for example, 10 doors you knock on, maybe one or two will actually open. That's why it's so important to enjoy the process, to stay engaged with the journey, not just the outcome. Through my career, there has been many project ideas and strategies that didn't work as expected or had to be stopped early because it didn't meet the initial goals. But for those experiences, I think are essential. They teach you how to think more clearly, how to refine your approach, and how to make better decisions moving forward. So in the end, failure is not something to avoid; it's something to learn from, and ultimately something that helps you grow. I think so.
Thank you for sharing that. It's a powerful reminder that growth often comes from challenges. One final question for our younger listeners. If someone is interested in working with you, whether in research or clinical training, what's the best way to reach out?
Well, first of all, it's a pleasure to connect with colleagues and collaborators of new ideas or projects. I strongly believe that meaningful science is built through collaboration. So I'm always open to new opportunities, and many of these collaborations have started remotely and later developed into a person partnership. Today, probably the easy way to reach me is through social media platforms such as LinkedIn or X. Uh, Always, I say, feel free to send me a message if you have some ideas, projects, or questions. It would be more than happy to respond, to support your initiative, and hopefully to connect in person at one of the major international scientific meetings, such as the European Atherosclerosis Society meeting that is lovely. This is my 14 in a row EIS Congress. So we can send me again a message and try to connect or meet me at, for example, the EDIS Congress.
That's very helpful and encouraging for those looking to get involved. Thank you. Professor Corral, thank you so much for taking the time to speak with us. It's been a real pleasure learning from your experiences and insights and bringing your perspective from Argentina to our global audience. We truly appreciate your contributions to science, research, and mentorship.
Thank you, Beli. It was really a pleasure for me. I really enjoyed that interview, and congratulations for your initiative.
Thank you very much. And to our listeners, thank you for tuning in. If you enjoyed this episode, please subscribe to AtheroTalk, leave us a review, and share it with your colleagues. Until next time, stay curious, stay connected, and thank you for listening to AtheroTalk.